We have a real treat for you now. So Jonathan Bush is, without question, a local rock star in healthcare, as well as entrepreneurship, as well as business formation. I mean, everyone wants to follow his path. And I first met Jonathan, I suspect he doesn't remember this. We were on a panel together many, many years ago. It was something called the Mass Technology Leadership Council. athenahealth had just been born at that point. And I remember thinking, the guy's kind of brash. Now I know why, because he has a right to be. He's done amazing things. It's so rare to have an individual form a company, grow it, take it public, and then work to morph it into something completely different, which is really the legacy that he's brought us with athenahealth. And he's going to talk today about his story. I'm not 100% sure whether it'll be about Athena, about More Disruption, Please, which is an interesting thing they're doing, or his book that he was just signing for us. I know whatever it is, it's going to be educational and entertaining. Please welcome warmly Jonathan Bush.
Thank you. Don't knock that. It's the book. I'm going to do the book. Because this is partners. It's Harvard and partners. This is like the makers of Manners, Kiss Me Kate. So I've got in my book, in my speech here, I have Keynote speechy slides where I talk about the macro picture. So you have that for one of these. I have a disease that I've named because that way you can be at one of these conferences. And then I got some ideas about some stories from the book if you want to read it. We can talk about whatever you want, but I've got these cool colored pictures. So we good with that one? Okay. So here's the first keynote-y slide, and everyone does this, right? So it's 18% of all the money that the median American makes for their entire life is now taken by force. It's not a choice. You have to do that. You have to give that money up to healthcare. And with that expense, 62 million Americans have said, fangul to primary care. They choose not to have it. 85%, when we reach out and tell Medicare beneficiaries, hey, great news, there's this benefit you get where you can, without paying, get a wellness visit, 85% say no thank you. And if you roll it all up in the macro, we are crushing Pakistan in terms of the public health status that we're accomplishing with these $3 trillion. So it's not great. So you must assume that inside the belly of the beast, the doctors are laughing their asses off, enjoying themselves. And of course, they're not. They don't like it. 55% of what a doctor orders, they don't actually see again. It doesn't actually match. They get to spend about an average of 8 minutes with a patient. And 59% of them don't recommend medicine to their friends and family. So they're not actually laughing all the way to the bank much either. So it seems like nobody's winning. It feels like everybody's feeling like a prisoner. And so it's actually one of these things where I actually think the most horrible thing about healthcare is not how much it costs, but rather that for all that money, nobody seems to be really being able to express their humanity. Nobody's tricking out their healthcare and picking up the ladies, either as a doctor or as a patient. And so that's the kind of thing that I want to take on. I want to go over the psychic syndrome, which is where my disease comes up, that causes that sort of entrapped negative feeling. We'll leave healthcare because I don't want anybody to get defensive. Well, I do want you to get defensive, but I'll creep up on it. We'll look at another sector. We'll look at, any sector. All sort of products and services in the world, all industry sectors start with some new idea, right? Some cool new invention of some kind, and then, oh my God, someone else has got one like mine. And then you compete and you innovate and you dodge and you weave and you go to customers or prospective customers and you say, hey, come hither with me. I've got this future coming that's going to be grand. Don't go with her, go with me, right? And they give things away and they make offers and they evangelize. because they had so much more to gain by getting customers on board than they do by screwing the customers that they have. But then over time, the ones that succeed, by the way, URQS, my disease, it's a rare disease that's only, it's like hemophilia, it's only available to the elites of society because they have to compete and defend and win, compete and innovate and win in order to be stuck defending what they have. Because those innovators that have done that well enough end up with more customers on board than they have people to say, come hither with me. And so this natural phenomena suddenly takes over the institution or the person or anyone where they actually need to kind of screw their customers and employees in order to prosper because there's not enough new soil to go till. And we saw this with Microsoft. Remember how cool, some of you maybe weren't born at this point, but Microsoft was actually cool once. They had the campus, and there was this network effect where you could, instead of word processing was where you would organize the word and print it instead of using your typewriter, you could actually email these things, electronically mail these things, and then the words could be processed again on the other side of the message. It was amazing, and they were so cool, and people who got jobs at Microsoft were wicked awesome. And no matter how hard they tried, little Apple could not seem to bust in. They couldn't ever get any market share away from that dominant player. Until when? What happened? Did Apple ever beat the dominant player? Microsoft raised prices, reduced features. It got lamer and lamer and more sclerotic, right? But kept winning. They were always dominant in the upper right quadrant of the computer sector. But then what happened? Why did Apple end up bigger than Microsoft? Do you remember? Think different. What was the difference? Was it the really cool ads with Jeff Goldblum? Was it the titanium laptops? iPhone, right? It started not with the iPhone, it started with something else. It started with the iPod, right? So Jobs goes, no matter what I do, no matter how cool my ads, my products, I cannot beat this guy. He dominates the upper right quadrant, his monopoly power. So what do? I can't sell computers. Maybe I can sell computing. Where else would I put computing? Where else could I put it? We need something where no matter how bad we suck, it'll be amazing. And somebody's like, hey, how about teenagers? Right? It's like, all right, well, let's do computing on music in little tiny boxes and let people like wick it and flick it and, you know, swirl. Remember you would go around for a while? Now you kind of... and sure enough, boom. He didn't win, but he redefined the market so that he was small. Even now, at his giant size, and he's dead, it occurred to me in the middle of the sentence that he was dead. He's still only 16% of the computers in the market. And really, he's only about 5% of the computing. By defining the market so broad, the natural genetic impulse of that company became that original evangelical, come hither with me, and they became realigned with the customer. Whereas Microsoft hasn't been able to find a thing that there's millions of miles of unplowed soils ahead of them on, and so they end up trapped in this kind of, I have to kind of raise price. I can talk about managing computing costs, but really I need it to go up. Sound familiar? You ever seen one of these? Right? You got the big hospital on one side of town, the big hospital on the other side of the town. The only thing keeping costs down is the health plan beating them up. And so what do? They tie the knot, and they enter the upper right quadrant. And they get so many members, they have so much market share, I'm not pointing out any particular institutions or anything, that the only way they can prosper, no matter how good and generous and interested in connected health the people who work inside the belly of these institutions are, they still pretty much have to screw you, right? They still have to buy closed systems that make it really hard to refer away. They have to prevent innovation from happening because the only thing that will happen if people shop or change or innovate is that they'll go somewhere else. How could you possibly want that to happen if you've defined your market narrowly and you already are stuck in the upper right quadrant? These institutions are excellent institutions. They got to the upper right quadrant through generations of excellence. But anyway, there they are. So now, what is the trick? what do these institutions, what do all of us, because healthcare in and of itself is pretty narrowly defined. We've got CPT codes and ICD codes and medical licenses and boards and certificates of need. We have lots of things that prevent the Steve Jobs move of reinventing the definition of the product so that it's big, so that we can all say, come hither with me, don't we? So what could we do? Well, we can't do these differently. So if you look at Massachusetts, where we sit today, over the course of my running athenahealth, the original, the first time we started seeing the cost of mammograms and colonoscopies was about 99, and if you take, was 2001, and if you take it through today, there's been about a 90% increase in the price, the amount paid for these services, and their clinical impact is about identical. There's no some sort of life-saving twist on the colonoscopy that I know about. Meanwhile, over the same period of time, LASIK vision correction was at $3,000 an eye in 2001, and it's about $200 an eye, and they'll drive you there in a shuttle bus. So despite the fact that we think of ourselves as being in an open market economy, those things that are inside the upper right quadrant are about as, shopper-friendly as the legally defined set of options for North Korean men to get haircuts. Don't worry, ladies, it's much different for the women. There are 16 legally defined accepted haircuts. So, and yet I am not daunted. I actually think that we are sitting on the cusp of an oil boom of innovation, of recreation, despite these very powerful institutions who themselves don't like how they have to act. I want to give you some examples. The first one was one I tried before I started Athena, which was a total fail. My idea, I was driving an ambulance in New Orleans, great job. As long as you're good with $9.35 an hour, you could do it forever. But what I noticed was about half our calls were to the same people every time. And they had chronic diseases, and if we had most of the drugs and equipment we needed to stabilize these chronic diseases on the ambulance, but if we did that, then we could bill for the equipment we used. Whereas if we transported the patient to the emergency room, we could bill $500. And then once they got to the emergency room had the same problem where if they spend the night, they get $2,000, where if they treat them at the door, they get $1,800. And so guess what? We transported like 98% of the people that we responded to. And then American Medical Response got started, and I thought, oh, well, for sure, they'll see this obvious arbitrage, and it'll go away. And now it's 2014 and still there, so anybody who wants to try that. Community paramedicine is now legal in several states, and that option exists. The second thing I tried was women's health. So maternity care is very expensive in the United States, like 2x what it is in the UK, and our outcomes are actually not as good, so what's going on? Well, one of the things is we treat every maternity case in the United States as if you're sick. And so the thesis of our business is it's possible to be pregnant and not sick. Just saying. And so we changed the staffing model around maternity care, and the doctors involved in our clients' maternity care were ones who were treating the moms who were pregnant and sick, which was about 6%, or maybe sick. It was about 6%. The other 94% had midwives, nutritionists, group care, and fabulous outcomes. And so, of course, it was a big success. No, it was a total fail. Many of the upper right quadrant players in the market wanted us to die because we were taking volume away from OBs and operating rooms and labor and delivery units, and we couldn't figure it out. But as we tried, as the waters kind of swirled around our nose, we built more and more and more connections into this hospital system and that insurance company system and that payer website. And pretty soon, a venture capitalist offered me $11 million for a copy of the website we used to organize our patients. I was like, let me get back to you, because we were going under, and I was like, 11 million is way more than no million. But we got together as a team and we said, oh, no, wait. This is the lucky knock at the door that all of you are starting companies. Great job, excellent, it's a great plan, and it will fail. It's okay, they all fail. But if you do it hard enough and well enough, you'll notice the lucky break that will come as you fail, and then you'll have a great company. At least that's my experience. And what we discovered was, oh, you can't do these reorganized care, ambulance, reorganized care, women's health, reorganized care with cloud-based radiology, all these businesses that are kind of not quite making it, unless there's some sort of underlying information backbone. There has to be some way of connecting the baseline information. There has to be some place from which improvement can be measured. And then that's your opportunity. That's your financial arbitrage. And if you define the cost broadly enough, and you can take enough financial responsibility, you can do all kinds of things that aren't in the defined healthcare delivery market. You can actually get out of the upper right quadrant. And there are examples. A group of doctors in Florida got together. They got onto athenahealth, and that's why I know who they are. They got a way too good a discount from us, and they shared the discount with anyone who would join them, and it kept getting bigger and bigger. But what's really interesting is once they got big enough, they went to Blue Cross of Florida and they said, how about this? They took venture capital, it's a group of doctors, took $40 million of venture capital, and they went to Blue Cross of Florida and said, how about we give you your first reduction in the total cost of maternity care that you've had in the last 18 years? So the only deal is we get to decide where everybody goes. They got the deal. Now they've turned around and they're going hospital. They admit to they have 25% of the maternity care in the state of Florida. They're going to I think they admit to 46 hospitals. And according to their calculations, in order to keep things really convenient, they need about 24 of them. And so they're saying, okay, here's our list of demands. I'm Tina Turner, and this is the Thunderdome. Which hospital gets to leave? And I don't know how it ends, but it's kind of interesting. You may wonder, though, as we sit in the shadow of a great tertiary medical center temple, what happens to the tertiary medical center? Are they just supposed to die? All these amazing things that happen. We saved 250 people. Nobody could have done what we did when we had that marathon bombing. Do these big, huge institutions with all these deep skills just go away? And the answer is no. I think that there's an opportunity for tertiary medicine to get themselves out of their own upper right quadrant as well. As doctors shop them for obvious secondary, primary care and commoditize the stuff that should be commoditized, what they can do is start to super regionalize. And a great example of this is the Cleveland Clinic. So Cleveland Clinic now, they're closing 2 hospitals and they've hired 8 salespeople. B2B sales guys, big enterprise sales guys. And the enterprise sales guys go around to large employers and they say, listen, we will do advanced cardiac surgery for any of your employees for 20% less than it costs you to do it at the cheapest local community hospital, and we will fly them in and fly them back with a loved one. So they're actually out there negotiating rates that are significantly lower than they have in Cleveland. And they got Lowe's stores. So all 250,000 employees and dependents of Lowe's stores, now when they end up in need of advanced heart surgery, get flown to the Cleveland Clinic. I believe they just announced Walmart on the same deal. And these 8 sales guys are going around the world. And what's happening at the Cleveland Clinic is a slow mix shift. So this elaborate, some of you have probably been there with the big granite things and the fountains, that also has really, really overpriced identical colonoscopies to the surgery center across the street, right, is starting to shift. The colonoscopies are starting to go away, and the surgeries and the advanced care is starting to concentrate. They're getting more and more and more of it. They're getting better and better and better at it. Even at lower gross margin, the margin dollars that they get from each of those is dramatically higher than an 80% margin colonoscopy or mammogram. So they're actually making more money, getting better at these rare things, more attractive to fellows because you get more chances. You know the fast med idea, right? Set up across the street from the emergency room. Don't take 4 hours, take 4 minutes, and call them the next day and say, how was that for you? I loved it. Do you want to come back? This is one of my favorites. If you get Connected Health, you could actually pull all the data that the complex established market generates on a patient and concentrate it. You can actually say, I'm going to make this medical record usable for a patient. Take all that complicated stuff and cook it down. CareSync does this. And here's their first patient. And she's 15. She's been in the hospital on and off for 5 years. She gets this iPad app where they've literally downloaded from all the different closed medical records, had to type it in sometimes, pulled all of this data together into one little app, and this 15-year-old who's been in the hospital for 1/3 of her life is swiping. And she gets to this part and says, well, what's this part here? I said, oh, those are the vitals that we take when you're in the hospital. Well, you don't take them when I'm not in the hospital. No, that's just more a thing that the nurses do when you're here so that you'll be safe. Well, am I less safe at home, she says. No, you're fine at home. You're not more safe either place. I said, well, they do them all night. She said, yeah, because, shift change, and the quality committee wants to make sure that you're stable the whole time. She said, well, is sleep important to my condition? Oh, yes, absolutely. That's the most important thing at this stage, given what you've been through. I said, well, but because you wake me up, and you said can I not have this chunk here, these rounds? And the doctors are all looking at each other, and they've really dug in on this kid. They really want it. They think they can beat this. But she really does need sleep. And they're like, well, you'd have to sign. You said to her mom, you'd have to sign some sort of release. We don't do the. She's like, okay, we'll sign the release. And she says, okay. So those lights by the pump there behind me? When I asked them to turn that off, they said that they couldn't because the safety committee didn't want the nurses to trip when they came in to do the vitals. So now can you turn them off? It's got the lights off. That's my idea of disruptive entrepreneurship. And so there it is. We're in this Gordian knot with government and caregivers and patients, and we're all pulling. But I submit to you that there's an opportunity to push. There's an opportunity to be a nut. I'm reminded of Shackleton, who said in his famous ad, men wanted for hazardous journey, small wages, bitter cold, long months of complete darkness, constant danger, safe return doubtful, honor and recognition, though, in case of success. I believe everyone in this room is in a very similar situation, but I think it's worth doing it. After all, this guy did it. I leave you with the ultimate model for the healthcare entrepreneur. This dude is all alone, and everyone thinks he's a loser. But then soon, oh my God, it's in fast forward, you're missing the agony. And then eventually, he does it long enough that people are attracted, and then girls are there, and then everyone's doing it that way, and then that's how we do the concert. So I submit to you that while it will be very lonely, and while you will be very much boxed out for a long period of time, the right thing to do is to take the hazardous journey onto the unoccupied grass, take off a large percentage of your clothes, and start to dance. It is the only way you will change healthcare. Who's with me? Thank you guys very much.